Hi, I'm Ryan Nutter with Cornerstone Senior Advisors, and each day we walk people through the process of Medicare to help them find the right plan at the right price. And today we're going to be looking at the Medicare Supplement Plan N and how it works with Medicare. So when we talk about Medicare, we're talking about two parts, Medicare Part A and Part B. And this is Original Medicare over here, and this is what Medicare covers. This middle column shows us what your out-of-pocket exposure is if you don't have any supplemental insurance. So a Medicare Supplement Plan, also known as a Medigap plan, fills the gaps of Medicare and helps you with these costs which you're exposed to without any supplemental help. So Part A of Medicare is your hospitalization. And day one, you're admitted to a hospital, you have a deductible of $1,408. These are 2020 prices. Medicare has been increasing these costs each year, and so as time goes and you're watching this down the road, these costs may be a little bit higher, but as of 2020, these are what the costs are. And day one, you're admitted to a hospital, you pay $1,408. This will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you pay that $1,408, you're there 5 days, you go home, 2 months later, you're back in the hospital, you're going to pay this deductible again. So you could pay this deductible several times in the year if it's a rough year. With a Medicare Supplement Plan N, if you're admitted to a hospital, you pay zero. They're going to take care of this deductible for you. This Plan N will take care of this deductible for you, take care of the deductible for you every time. So you don't ever have to worry about that deductible. Now, if you're in the hospital for over 60 days, say you're in there for a third month, days 61 to 90, you're going to have to pay each day you're in there a per day copay of $352. This Plan N will pay that for you. If you're in there for over 90 days, that fourth and fifth month, now your per day copay doubles to $704, which you have to pay each day. This Plan N pays that for you. So with a Plan N, if you combine a Plan N with Medicare and you end up admitted to a hospital, you're basically just going to get a statement of benefits paid. It's really dynamite coverage. This is nationwide coverage. There's no network. You don't have to worry. If you ended up with cancer and you wanted to go to MD Anderson in Houston, Texas, the premier cancer clinic out there, you can just go. You don't have to have a referral. So it's really dynamite coverage. Now outside of the hospital, that's Part B. Part B is everything outside the hospital. Primary care doctor, specialists, emergency rooms, outpatient surgeries, so on and so forth. And Part B has a deductible of $198. Now this deductible is different from your Part A deductible because it is annual. You just pay this one time a year. And with the Plan N, the Plan N is not going to pay this deductible for you. So you will have to pay $198 each year with a Plan N. Again, this could go up over time if Medicare decides to raise that deductible a little bit. But this deductible, it is annual. You pay the first $198. Once that's been paid, then Medicare is going to kick in and they're basically going to cover 80% of your costs with anything outside of the hospital. So when you hear somebody tell you, if you've ever heard, well, you need to get a Medicare supplement to cover the 20%, this is what they're talking about. Because after this deductible is paid, Medicare is going to pay 80% and you're going to pay 20%. So anytime you go to your primary care doctor, you have to pay 20%. When you see a specialist, heart doctor, lung doctor, physical therapist, you're going to pay 20%. If you ended up with cancer and every time you go in for chemo, radiation, you're going to pay 20%. Outpatient surgeries, you go into a hospital, you have a cataract surgery done, you go home the same day, you're going to pay 20%. This Plan N, the way it works is anytime you see a primary care doctor, a specialist, something like that, you're going to pay up to a $20 copay. So I say up to $20. It's never more than $20. Sometimes it's less than $20. But whenever you see a primary care doctor or a specialist, heart doctor, lung doctor, like I was discussing, you will have a copay of up to $20. Now, something that's not on here is emergency room visits. You could pay up to $50 if you end up admitted to an emergency room. So there's a little bit of copays that come with this Plan N. But when you compare it to other Medicare supplement plans like the G or the F, you're going to be able to save premium by going with the Plan N if you're okay with some of these out-of-pocket costs and some of the copays. So the Plan N can be somewhat, the popular plans, the G or the F, there's much more enrollees on that plan every year, but this can be popular when someone is okay with just paying a little bit of out-of-pocket costs. So that's how the Plan N works. That's what the coverage looks like. One more note I will add is Medicare tells these doctors, so anytime you go to a doctor, any type of health professional you're seeing, if they take Medicare, that means they're taking the Medicare approved amount. They're accepting the Medicare approved amount. So Medicare tells these doctors how much they're allowed to bill for the services. These doctors can, if they choose to, charge up to 15% more than what Medicare assigns them. And if you do, you have to pay the overcharge. This Plan N is not going to pay that overcharge for you. And that kind of gets complicated. It hasn't been a huge issue. There hasn't been a lot of facilities that take advantage of that overcharge. 10 years from now, maybe that's a different story. But to this point, it's not been a huge issue. But that's one more note I might throw in about the Plan N is if a doctor decides to charge more than what Medicare assigns them, you will have to pay whatever that overcharge is with the N. So hopefully that's helpful as you're trying to wade the waters and figure out what supplemental plan is right for you. This is something we can help you with. We can discuss companies that are available in your area. We can discuss what premiums they're charging. We're completely transparent. We're not tied to any one company, and we can get you signed up with whichever company you decide. You can just give us a call, 260, it's 316-260-3331. Thank you.